So welcome to our latest instalment of PLOS Mental Health, The Bigger Picture. As a reminder, this is a quarterly seminar series hosted by PLOS Mental Health, in which some of our senior editors discuss a study that has been recently published in the journal and has involved early career researchers or researchers from historically underrepresented communities, or the study aims to advance our understanding of the needs of underrepresented communities. So today we will be talking about workplace wellbeing and focusing on a scoping review in PLOS Mental Health titled Sick Leave or Work Sick, examining the antecedents and conceptualizations of presenteeism and absenteeism among teleworkers during COVID-19. The study was led by Dr. Behdin Nowrouzi-Kia from the University of Toronto, and he is joining us for this discussion today. He also happens to be an academic editor for PLOS Mental Health as well. We're also joined by Professor Beste, who's section editor for Cognition and Mental Health, Dr. Sarah Jones, who is a section editor for our Occupational Mental Health section, and our co-editor-in-chief, Charlene Sunkel. So we've all done it, haven't we? At some point, we've pushed ourselves to keep working when we're sick, and some may have even taken a sick day when they were okay, they just simply couldn't face work. And there's definitely a culture of expectation and a sense of judgment, whether that's people around us or ourselves in the workplace. And sometimes that does come from the environment that we're in. Sometimes it comes from things going on otherwise, or sometimes it's just an internal thing. But in order to support people to improve their mental health at work and thereby improve productivity, what is it exactly that we're targeting here? What is it that's determining the behaviours that we conduct at work? So I'm going to hand over now to Behdin, who's going to summarise the key findings of this paper, and then we will open up to some discussion.
Sure. Thank you very much for having me. Thanks to the journal for publishing this paper. We're really excited to have an opportunity to talk to you more about it and give you more insights into the paper and hopefully have a stimulating discussion afterwards. Really, the essence of what we explored in this was looking at mental health initiatives, looking at policy responses, and the importance of integrating all of this with the lived experience. So we didn't want to forget that. So our scoping review was really an literature synthesis of what looks like to look at the concepts of absenteeism and presenteeism, but not only from a structural program perspective. We wanted to look at it through that social determinants of health perspective, and we kind of identified our papers into several different buckets. One looking at the environmental considerations, so that could be the organizational culture, it could be the built environment itself. We also looked at the individual into this aspect of it. So how do they manage and navigate the complexities of work and health, and also how all of that influences their ability to function, perform, and succeed and thrive in that environment. And we also look at it from the employer's perspective, because naturally, when you're looking at work, that is an important perspective to look at. And we looked at thousands of participants and many papers in it. And really, in a nutshell, what we looked at is how important it is for us to focus on a perspective that includes the lived experience, but at the same time recognizing that employers play a significant role. And oftentimes we can look at it through a top-down policy where we can encourage employers to model and support workplaces through a variety of actionable approaches, meaning that, not only do they role model what they do, but they also provide environments where workers or employers can succeed. At the same time, we want to look at the literature, and the literature clearly states to us that the lived experience is important, that of the person who is in that environment and working, because people are very passionate about what they do. They want to succeed. They go to work wanting to make a difference in people's lives, and that's very much true no matter what kind of work that you do. So that needs to be recognized and leveraged. I would say it needs to be captured into the discussion far more fulsomely than we have so far. And I think that's really the essence of our scoping review, is one, that we want to recognize the lived experience of individuals when it comes to workplace mental health issues. Two, bring together the employer side with that of the worker or the employee side, and see how they can work together to promote and leverage opportunities to improve workplace mental health. So no longer is the idea that it's, the responsibility of the individual to go to a yoga class or a meditation studio, and the burden doesn't fall on them. At the same time, it's not entirely just the employer's responsibility either. They have to come together and work through perhaps a co-design approach to look at ways to support workplace mental health and augment well-being in the workplace.
Cool. So we kind of had some questions, I know, that kind of focusing in on the main messages of the paper and then kind of expanding out to more general concepts and how we can use that to come up with recommendations. So just to start off with Christian, who had some questions about what you found in the paper.
Yeah, thanks, Karli, and thanks, Behdin, for being with us. It's a pleasure that you are here. And I think you're actually addressing a very, very important topic that follows us every day. I have kind of a few more practical questions because this is completely outside my primary field of research, but nevertheless very much interested in. So you have shown that there is a difference between this absenteeism and presenteeism. And this is modulated, so to say, by whether or not there is an opportunity to do work at home. Could you maybe provide some recommendations or share your insights about what or how are companies being best advised? Should they more prefer the absenteeism, presenteeism, or is there an intricate balance that is to be met, and how to do that?
Yeah, thank you, Christian. Appreciate the question, and I think it's an excellent question to get us started. I think maybe just to the benefit of the audience, when we're talking about presenteeism, we're looking at essentially going to work when you're not feeling well or you're ill. Well, absenteeism is essentially being off work or being on sick leave. Just so to preface what I'll be discussing this, and I think from the employer side, what we found in our research is really that they play a very important role, and oftentimes employers will come to me, just from my experience as an occupational therapist and also in my own research, and say, we want to help, but it's like, how can we help? And I think your question centers exactly on how is it. So they come into this with good intentions, and our paper found that as well, is that they're meaningfully trying to play their important role, and they play a critical role in, for example, looking at workplace accommodations and what that looks like, particularly with mental health, because mental health is very different than, for example, if you break your arm and you want to go back to work. There's lots of different considerations around that. So, for example, you may not see the actual conditions. When you fracture a bone, you go in, everybody sees a cast. Oh, okay, so and so is has a broken bone. It takes some time for them to get better. With mental health, it may not be visible. Somebody may be experiencing significant medical issues, like having major depressive disorder, and when you go to work, you may not see it. So, a coworker or a manager may say, "Well, they seem fine. Why is it that they need quote unquote special treatment?" So I think from the perspective of the employer, there's several things they can do. One is that they can work very closely with the worker themselves and their allies and supporters, which can include healthcare professionals, human resources, union representation, and also associations, and also people that are supportive in their family groups, such as loved ones, etc. They can all come together and work together to kind of look at what this looks like. So, for example, if a healthcare professional provides a medical evaluation of what may be supportive to bring this person back to work after a medical condition that may include, for example, a major depressive disorder, the workplace is ultimately the one that's going to provide those accommodations. So it's really working together and coming up with a solution that is going to be consistent, but consistency doesn't always mean rigidity. So what I mean by that is that if there is a policy around workplace discrimination or mental health supports going back to work, apply it in a fair manner, but be mindful that there could be differences between each person, and there will be, and to apply that fairness across recognizing the different aspects of a person's ability and the differences that all of us come across. Because when we look at this, all of us want individualized care. Like if you go to your healthcare provider, you want them to see you as an individual, recognize your unique contributions and your unique aspects, and provide that and integrate that into the care care, the medicine that you receive, and the treatments that you provide. Same idea applies to, supporting people in the workplace. So from the employer side, I would say recognize that every person is unique. Talk to the key stakeholders that are involved. Oftentimes that includes the medical practitioners that have the medical side, but that's not the entire picture. Otherwise, we would have solved these problems many decades ago if we used just a biomedical perspective. And to link it back to our paper, we emphasize the importance of the social determinants of health and how important it is that we go well beyond just a diagnosis or an assessment or treatment and go to the point where we see how do we bring this person into the workplace, or how do we keep them in the workplace, and what does that look for that individual. So for some people, it may be that they need additional accommodations around extra time, revised workloads, but others may have more straightforward trajectory. So having a consistent policy helps, but recognizing that that consistency also needs to be, there needs to be opportunity to apply fairness and having flexibility to tweak it for each individual. And that's where it's really important for employers to not only have appreciation about accommodation, but also have additional training around mental health practice and policy.
Mm. Yeah, thanks a lot. If you were, so to say, to make a ranking of the factors, and you have identified 3 major themes, so organizational ones, environmental ones, and individual ones, what are the most decisive factors from your point of view, and how to tackle these?
Yeah, I think, that's a great question too. And it really depends on the perspective. I think the long-standing literature in this area is often focused on the individual factors and placing that as at the top of the importance, I suppose, the individual factors. And this has been traditionally cited for many, many decades. And I think what we're shifting towards now is not only just moving away from that, but looking at more of a collaborative co-design. So one where there's shared responsibility. So when I see my clients, I oftentimes emphasize that this is not going to be a one-way street where everything falls upon you. But at the same time, it's not just the employer who has to bend backwards to and make sure that everything is perfect for you. It's a shared collaborative approach. So I would say the ranking for me, it depends on the perspective. But I would say all of this has to go together. So the individual, the organization, and the employer's perspective have to be looked at the same time, because these are complex issues. And to look at it from one perspective may mean that we're going to fall back into some of the considerations that we had decades ago around, focusing just on the individual and health promotion strategies that looked at providing, healthy lunches, opportunities to exercise during breaks, or going to yoga. And we know that employees, and workers now are telling us that that's helpful to an extent, but it has to be more than that. So I would say let's look at it through a perspective where all 3 are important, and that lens is how we're going to inform policies around work recommendation, policy, mental health policies, and also how we want to support somebody's stay or return to work.
I see. I mean, when you were talking about video conferencing and working from home, I mean, this applies
Yep.
to many occupations,
Yes.
let's say in the finance sector,
Yeah.
or generally in lawyer sector or whatever it is. But when you get, for example, to the healthcare sector, where you have really huge pressure in the job, where you have lots of responsibilities, where you have to be there, so you cannot go out. So there is no really an option of absenteeism. Yeah, there is a high pressure of presenteeism. So how do your findings apply to that specific part of occupation in the healthcare sector, for example?
Great question. I think one that's $1 million question right now in our healthcare systems, I think both in the global north and the global south. We have a significant health human resources crisis. Here at the University of Toronto, I'm in a program where we train healthcare professionals. So I live and breathe this on a day-to-day basis. And it is very challenging because on the one hand, we have these workplaces that are very high pressure, like you say. There's an incredibly high workload, and it's staffed by people that are really caring and want to make a difference, right? You go into these professions, particularly in health and education, if I can use them, although there are many other examples in finance and IT that apply to some extent as well. But in health and education, people go into this because they care. They want to be in helping professions. They want to make a difference to the people that they serve. But what the challenges become is that oftentimes you go into these environments and there's significant challenges around shortage of workers and in high pressure environments. And how do you address that? Really, what we have to do is exactly what we found from the literature, is that co-design models where the employer and the worker come together and look at the environment and how we can best look at supporting workplace mental health is the way to go. It's no longer good enough just to put the onus on the worker themselves, or to recent graduates in all of these fields. Like to train a healthcare professional takes many, many years, and people go into this, and oftentimes in the first couple of years they experience poor mental health, burnout, job dissatisfaction, and they want to leave the profession, and many do. So it further exacerbates things and makes things worse. So what I think the option here is, one is that we have to have decision makers, both in the employer setting and also in academic institutions, recognize that these are significant issues and resources have to be brought into them. So resources, I'm not just talking about financial resources, I'm talking about education, advocacy, and models that look at providing senior leaders with an opportunity to get educated on mental health policies and practices, recognize that you can model good workplace behaviors. For example, if it's at the end of the day, you take the time off and you tell others to do the same. But in busy clinical environments, ensuring that people have a say in what it is that the decisions are made around shift work, around workload policies, and having them involved in that, because that's going to model the good behavior. And also creating spaces for the practitioners, the healthcare groups, and the educators to be able to voice when they have concerns. And I think this is something that's very interesting, and we're seeing in some of our research elsewhere, where there are temporal effects related to age, gender, and cultural aspects that intersect this work as well. So I think all of this has to be considered. And I think we're more or less going in this direction. It's slow, but I think it recognizes that, these are not easy fixes. We can't just essentially just pour money into it and fix it overnight, but rather these are complex systems that we've designed over many years and decades. And in order to fix them in the sense of ameliorating the workplace environments and policies that we have to essentially peel back all these layers slowly and look at these intricate relationships that have developed in these systems and address them on an individualized basis using co-design approaches.
Thank you.
See. Yeah.
Thank
I'm
you.
quite sure that Charlene and Sarah have many other different questions in that regard, so I would like to hand over to them.
I was going to say as well, actually, quickly, that one thing with, just to pick up on, you mentioned about, yoga and meditation, everything, only helps to some extent. What I've read a lot of is, obviously it's not for everyone, but one of the reasons why these don't work so well is because they're not kind of researched properly. It's kind of thrown in there to the workplace. There's an assumption it's going to help, or an expectation it's going to help, and look, we've done something to help staff, rather than reviewing, okay, let's see if this has actually helped. Has it not? Who is it helping? And then continually reviewing. I think that's also an important thing we have to constantly revisit, because people's needs and the climate is changing all the time. Sarah.
Thank you, and what a terrific paper. And in my opinion, the findings of the paper really echo, I think, a message that I'm always trying to get out to the world, which is that the equity isn't really about rigid fairness in the workplace. It's about responsive design, and that companies really need a strong policy as a baseline, but that real power to help employees and to allow people to flourish is when you're giving people room to adapt, managers to adapt to the policies, and individuals to adapt based on their needs, their roles, their realities. And I think that is one of the messages that is coming through here. Just to turn to the outcomes research, interestingly, not huge differences in mental health measurements based on work location for telework during COVID, but what other kinds of hidden variables do you think are going to make remote work harder for some groups than others? And I'm looking specifically not just at COVID, but really now and in the future with more people returning to the workplace, certainly in North America and in Western Europe. There is a greater demand in the workplace for people to return to work after having more flexible policies. I think that invites a potential schism in equity. And in fact, a US labor report survey this week that came out highlighted that in the last couple of years, the number of men returning to the workplace is outstripping the proportion of women returning to the workplace. And that's quite concerning for the future of women in work if they are going to miss out on career opportunities by being punished by CEOs or other companies whose policies say we're going to reward people for in-person working. And I would love to know what you think about what those hidden variables might be that show that some remote work might be harder for some groups than others.
Yeah, I think so. Now, that's a great point. I think looking at this from a DEI, diversity, equity, inclusion lens is really important. And I think the direction where this research is already headed, and we're seeing many papers that are coming into this, but obviously there's tensions with that geopolitically in different parts of the world today. But I think these are the key considerations that we need as researchers to kind of incorporate into the work that we do so we can kind of understand these considerations. I'll call them, from a scientific perspective, these variables, these characteristics that are, I think, gender, age, cultural considerations, disability. I come from a profession where we're often interested in looking at people's abilities and their functioning. So disability is naturally going to be part of this consideration. So, for example, here in Canada, before this pandemic and the shift towards a fully remote work started, many disability groups and people with lived experience of disability were always advocating that they could work productively remotely, and workplaces were very resistant to those types of accommodations for people because they said essentially if you work remotely, you're going to be less productive. And we know very much from the data that's been published since the pandemic, COVID-19 pandemic, and other research that's come out since then, that that's not the case. In fact, we're at the other end of the spectrum where there's people being overworked. So I think looking at this through an aspect that looks at gender diversity, looks at age, looks at cultural considerations, and one thing that we recognize in the work that we did, we largely looked at data that was published in the global north. So we're excluding the majority of the populations and perspectives that are in the global south from this discussion. And that to us is also has to be put into the research that moves forward. All of, we're coming to this from a perspective of one avenue coming from the global north, myself, the author of this paper, but recognizing that there's a lot more that we don't understand, and we don't know what we don't know. And in this perspective, there's lots of other considerations that we have no idea. And from the gendered perspective, it's so important for us to understand how remote work and also hybrid accommodations are impacting women and other gender expressions as well. We don't know a lot about it. Ultimately, what you've provided is that and what the research is showing is that there are sex and gender differences that are being further exacerbated by policies that employers and governments are putting into place without fully understanding what their implications are. And then to your point, Karli, around evidence-based practices and procedures are incredibly important. I'm certainly not dismissing individual level considerations around providing individual interventions, but making sure that one, they're evidence informed and evidence based, just like any other type of approach that we would recommend, because that's incredibly important. But at the same time, ensuring that there is a perspective that includes all of the stakeholders that need to be at the table. And oftentimes, those that are marginalized or on the periphery don't have their voices included, and that is extremely challenging when we're talking about identifying what isn't there, because oftentimes we're not looking at those spaces. And I think that's a significant consideration that we need to bring forward to the table, and including people with lived experiences of chronic conditions, episodic conditions, and so forth. And with mental health, this becomes particularly challenging because oftentimes they don't come in isolation. Like, you just don't have a mental health concern. You may have mental health with a chronic condition, with a disability, and you may be from a lower socioeconomic status or background in the global south. So all of these are multiplied and put on top of each other, and then it adds to a significant burden of not only functioning and disability, but also trying to engage in work. And work has many benefits. It has benefits financially. We know that work is very important to our health and well-being. Too much of it can be deleterious to our health, but too little of it also can damage the way we engage and thrive in our society. So I think there's a lot more to unpack, and we know some of these DEI considerations, but there's many that we don't know. And I think from an academic side, to be genuine and honest about this, we have to have these conversations and ensure that we do bring people with lived experience into our co-design of our work and how we move forward together, because they're going to bring perspectives that I don't have simply from a lived experience perspective or even the expertise. And I'm not just talking about at the individual level. I'm saying this both as an academic collective where we have to bring that. And I think the movement, particularly certainly in the global north and Western countries, is towards that type of approach, but we can go much further with it and also be inclusive. You know, that I piece of DEI or EDI, that I piece is really important to ensure that we bring our partners from other parts of the world and have them represented in our discussions today, in our editorial boards and so forth. And this is something that I challenge with. I'm not saying I have the solutions, but these are part of the problems. And let's work together in finding ways to move forward together so that we can identify more of these variables, these characteristics that are unknown to us today. I hope that helps in answering the question.
Absolutely, absolutely. I wonder also, just following on that, if the idea of qualitative sort of feedback, not just quantitative, from between employees and employers, do you feel like there should be sort of an equal amount of both when it comes to these conversations about the balance between the organizational, the environmental, and the individual factors? I feel as though the workplace has been moving more toward this heavy monitoring, quantitative, sort of quick dashboard on my employees, which in and of itself is shown to be stressful to employees just to be monitored electronically. And I wondered if you thought that it was time for the qualitative to be balanced with the qualitative when it comes to the co-design and discussion of these three factors: organizational, environmental, and individual.
Yeah, I agree. I think that there's natural tensions. And when I talk to employer groups, you know, oftentimes they'll say, you know, we're doing everything we can to support workers and employees in our organization, you know, and we're doing the best that we can. But I think there exists these tensions that you've identified around having these metrics of productivity, observing people's progress. When do they check in? When do they check out? How many breaks are they taking? How productive are they? And this applies across different sectors. And I think my response to them is that, you know, all of the stakeholders have to come together. So the employer has to sit at the table, and the worker or the employee and the various representations that support both sides should be there too, and engage in fulsome discussions that look at how everybody can benefit from a shared responsibility that looks at valuing productivity and return on investment and those types of metrics that are very important to employers, but at the same time looking that our most important attributes and if I can use a business term, assets, our human resources are our people. So when they're healthier, when they're better able to provide optimal care, functioning in whatever activities that they're doing, that's a win-win-win scenario. And oftentimes when I engage with employers in this way, their eyes light up in the room and they say, well, that makes sense to me. If I have a productive workforce that's also healthy, that's going to be beneficial for everybody. And it ripples itself across the spectrum and also well beyond the workplace. It's going to mean that your interactions, because, you know, we don't live in monoliths where we're just silos in the workplace. We interact with our families and loved ones outside of work. They interact with us. So I think this ability to have people have wholesome discussions that look at recognizing that the employer for many times is in it for profit or for productivity. Not always. There are sectors that aren't that's the case and depends on jurisdictions and so forth, but also that employees and workers that are healthy and well are going to be able to perform better. And I always use this example to our learners here, is to say that, you know, when you go into a hospital or a clinic or every different type of environment, if you're at the top of your game and you're healthy and well, and you can provide the best care, that's the type of healthcare provider that we want. If I'm the recipient of that care, that's exactly who I want. I don't want somebody who's been tired and is coming into work after an exhausting shift and has barely had time to go home, rest, and come back, and they're back into this again. That leads to poorer outcomes for everybody. So I think this is the opportunity we have to have these discussions more fulsomely, and rather than having these directives that come from a top-down approach without considerations of the workplace. And yes, it may take a little bit longer to have these discussions, but I don't see them as being antithetical to, for example, the models, the business models that are currently in place in the West or the North, the global North, but rather as ways or strategies that we can use to augment and improve the systems that we have. And I think that oftentimes is a tension, particularly in the West, where we have this, where people will say, well, this isn't aligned with how businesses operate. I will challenge that and say that if you look at the evidence shows that when your people are not well, it suffers on the bottom line, if I can just be very direct with you, financially as well. And these two conversations have to be had together.
Absolutely. Thank you for that.
Thank you. I think we've got time for one more question from Charlene.
Okay, let me shorten mine, because I think the discussion went quite nicely about everything I wanted to say. You mentioned about the Global North, the study being done there. So I was kind of trying to think about, you know, the Global South, where I am based, how different things are. Yeah. So considering like workplace policy, as well as employee assistance programs, it happens here quite often where there's like employment assistance programs, and they, let's say, for example, assign 5 counseling sessions for you. We all know, and then after that, the employee needs to pay out of pocket. So that's not very helpful. So, you know, you can't really work with a person for 5 sessions and now, you know, they receive a small salary and that. But what I want to, when I listen to all of this, what is so utterly important is the communication, open communication between the employee and employer. What I'm hearing from all of this discussion. And another element, and I think it happens quite a lot in our context and from our experience, is a power dynamics, because you can't have open communication if there's power dynamics. Like, this is the boss, I can't be open and honest about what my needs are. And then I also want to ask, maybe, to what extent is stigma also a barrier in all this? So kind of my question is that what recommendations would you give, let's say, considering the Global South, how to overcome this issues around stigma, you know, the power dynamics, cultural issues, in really ensuring there's a workplace policy that speaks to the needs of employee well-being?
Yeah, no, thank you for the question. I think it's an excellent one. And to bring that Global South perspective is so important and needed. I think the voice of the Global North is honestly overrepresented in the research, but I think there's many reasons for that. From my perspective, I think stigma, unfortunately, cross-cuts all of these jurisdictional boundaries, whether it's in the Global North or the Global South. I think that is going to be something that is very steeped and rooted in the mental health discussion, and particularly in the workplace, beyond that as well. So I think that is naturally going to be part of any type of discussion. I think what I've read in the literature, although I haven't studied this, I've read it, is that I think the stigma is depicted in different ways. There's probably more pronounced aspects of it in the Global South than the Global North, just because in the Global North, we are trying to raise the profile and ensure that, discussions around mental health in the workplace are put front and center. People have spaces and the ability to do that. I'm not saying we're doing a wonderful job at it, but I think we're a little bit further along on that discussion than in some parts of the Global South. But the Global South is enormous and there's lots of variability. So I can't speak to the entirety of it. So I think it's there, but I think what we really need to do is to recognize, again, back to those points around diversity, equity, and inclusion, and bring this into the discussion around the Global South. And it may not come out as being DEI, it may come out as being cross-cultural considerations, it may come out as other types of language, but I think that's what's missing that I think I would love to see more of. And I think the power differentials are enormous. They're enormous in the global north as well. And, you know, to be able to have the confidence to be able to go up to your manager, your supervisor, and have these discussions means that they have to be educated on the discussion, be part of the strategy to be your partner and ally to move forward, rather than seeing it through a punitive approach where they would say, no, absolutely not. And I think there's a lot of differences that we've seen in our research, whether it's in healthcare, education, or other sectors that we've studied, where we generally have seen younger workers, at least in our populations here in Canada, they're much more accepting of having the discussions, creating those spaces. I would say the under 35 group in particular is more receptive to this and being much more open and honest around, this is too much work for me, I can't do this, and putting boundaries. And I find that the older workers may be more stoic and may not want to disclose that. And I think that could also be part of the discussion that could be explored in the Global South further, and see what types of considerations like culture, age, gender come into discussion, because I think they'll probably be there, because we're seeing the same things here. The older workers are less likely to talk about it, to say that this is something that they have to deal with internally. And sometimes it manifests itself in catastrophic ways, right? So the outcomes could be horrific, dying by suicide, causing significant issues in the workplace around workplace violence, abuse, substance use. So we have to be able to look at this. And I think in the Global South, we poorly understand it in the Global North. I think it's completely unexplored, and we need to look at this much, much more carefully and much deeper as a collective from the academic community, but also with our partners in workplaces, those with lived experience as well.
Thank you so much. Yeah, I think we from the Global South can learn a lot from specifically your mistakes that you made and kind of adapt according to that.
Well
Thank you
said.
so much for that.
Thank you.
What I would also add, just before we finish, as someone based in the Global North, but part of Charlene's network, which was very much in the Global South, and interacting with a lot of people that are advocating reducing stigma in the Global South. Whilst the culture, the environment there, I think the stigma is greater. It's a lot harder to overcome that than it is in the Global North, for sure, and we don't have time to go into the reasons why. But the people that, such as Charlene, the people that are able to push past these barriers, are able to make an impact and reduce stigma under these conditions, in these situations, I think people in the Global North can learn a lot from them, and their resilience and their diligence and their fearlessness. And I think it's a lot, I'm involved in advocacy in both the Global North and the Global South, and it's a lot easier to do it in the North. You have to put in a lot less effort, you have to be a lot less brave, you have to be a lot less creative. It's kind of just all there at your fingertips. It's still difficult, it is. Anything where you're sharing about yourself, advocating, is difficult. But there's something about the way people in the Global South are doing it that I think us in the Global North could really learn from. So I think that is kind of an important message. But for sure, in general, there is an imbalance in that stigma. But I just wanted to thank you very much for today, and especially to Behdin for sharing his work with the journal and being part of this seminar series. And a lot of what you've said today, Behdin, and that you pointed out, is perfectly in line with our journal's mission. And it's a really good reminder of what we're trying to do across mental health disciplines. So it's been a real pleasure to have you and have your insight. And hopefully we can continue the conversation. And as Christian said earlier on, this is something we're all interested in because we experience it day to day. Our workplace, whatever it is, will always affect our well-being one way or another. And we need to keep speaking about it because mental health is so hidden and so unique, and intersectionality dictates our individual experiences, and we cannot move forward with effective tailored support without learning about the needs of everyone at different times. So I hope we can continue these conversations at PLOS Mental Health and with you as well. So thank you for joining us today.
Thank you for having me.